Ketamine is an illegal Class B drug, yet worse than heroin in the 1980s, according to one councillor in Liverpool. It's actually an anaesthetic and was once considered a niche party drug. Now, though, it's becoming mainstream. Home Office figures suggest ketamine consumption is estimated to have increased by 85% in the last year. Some want the government to urgently reclassify the drug to Class A, which would mean a tougher sentence up to life imprisonment for those selling it. That reclassification is something the sister of James Lee Williams, better known as the Vivienne, is campaigning for. The 32-year-old drag performer died in January of a cardiac arrest caused by taking ketamine, according to his family. We will talk to Lynn Hinnigan from Liverpool Council, former Children's Commissioner for England, Baroness Anne Longfield, and Chanel Williams, the Vivienne's sister, in a moment. First, I've been to the Hafan Wen Detox Facility, run by the charity Adferiad in Wrexham, and spoke to 23-year-old Holly, not her real name. She first took Ket aged 17 as a party drug, but then became addicted to it. That lasted for 5 years. She's just gone through the detox programme and warns people misusing it of the damage it can do to your bladder.
Strongly advise them to stop taking it because the effect that it's having on their bladder, they will lead to incontinence, which is they won't be able to make it to the toilet if they need a number one or number two. They'll have to be wearing pads in the daytime if they work and in the night time for night, because also in the night, if you're asleep, you won't feel it if you need to go for a wee. You'll just end up in the bed can be just wet.
Right. And when you say pads, do you mean nappies as well?
Yeah, like nappy pads. Like that's how you would have to, or like a large pad for a woman, or yeah, literally like a nappy, because there's no way that you can hold it because of how much damage it's done.
And ultimately, could that lead to somebody, if their bladder is wrecked by Ket use, having to have a colostomy bag?
Yeah, it does. That's how the long-term effect is. You will have to end up with a bag. You also get the stomach cramps that come with it as well. I've had them and they can last for up to a couple of days. And
what does that feel like?
Horrendous. I don't think a 12, 13-year-old child would be able to cope with that. I just about coped with it myself.
Because when you say stomach cramps, I think of period pains, which can be painful but doable.
Yeah.
What do you mean by stomach cramps?
It's like that, but 10 times stronger, I would say. And then after you've stopped cramping, you're then sick. And then after you've been sick, it's just like a dull ache for like days, and it just doesn't go. And so you have to stop taking ketamine for it to go. But then people are taking it to try and numb the pain, so you're putting it on top of each other. It's just a cycle, yeah.
Well, the senior nurse manager at the facility, Katie Bryan, told us there is a ketamine epidemic right here, right now. Liverpool City Council are really worried about the use of ketamine, particularly in and around Liverpool, particularly amongst young people. And one councillor has suggested that this is the equivalent of heroin in the 1980s.
Yeah.
Is that fair?
That's actually something I say myself. I think whereas 20, 30 years ago we had a heroin epidemic, I think we've got a ketamine epidemic now. Not coming, it's here and it's now.
Really?
So
that is crisis levels as far as you're concerned?
Absolutely, yeah.
And what damage can it do to someone?
So the main damage we're seeing is bladder damage in young people. So we're seeing 18, 19-year-olds with catheters, urostomy bags, wearing incontinence pads, so like nappy pads, because they can't hold their urine in. I actually spoke to urology last week and he said they've now had to set up a rapid access clinic just for ketamine bladder, so condition that's known as ketamine bladder for people who have taken ketamine. That's how bad. So it's over in our local hospital.
And what area is this?
So this is Wrexham. But yeah, they've had to set up a local rapid access clinic here because they're seeing so many young people coming through with urology problems.
Charlie is 25 and is recovering from a ketamine addiction. He was spending £50 to £70 every day on the drug, and his habit put him in hospital 9 times.
At my worst, I was probably using like 5 to 7 grams a day, and that was consistently every single day, morning to night, and yeah, just whenever I was awake I would be using, yeah. I was hospitalised 9 times in total over the sort of 3 or 4 year stint that it was really, really bad. Going to hospital with like stomach cramps, ket cramps they're called, amongst like the people that use ket cramps. I was struggling to walk, I was keeled over walking. Some days I just wouldn't leave the house at all because I couldn't even like go to the toilet, I was in so much pain.
Well, Chanel Williams, who is sister of the Vivienne, real name James, who died from a cardiac arrest after taking Ket, was with us at the detox facility, and she explained what is motivating her campaign to raise awareness of the dangers of Ket and to get it reclassified from Class B to a Class A drug.
I want to help other people because what we have been through is the most heartbreaking thing. To lose my brother, to see my parents go through the battle that they are going through, to lose their son. My daughters have lost their uncle, and if I can help one family to not feel what we are feeling, then it's all worth it.
James was 32?
Yeah.
I mean, it's such a waste, isn't it?
Yeah, he has his whole life ahead of him.
And Chanel is here with us in the studio, as is Councillor Lynnie Hinnigan from Liverpool City Council and the former Children's Commissioner for England, Labour peer Baroness Anne Longfield. Welcome all of you. Thank you for being with us. Chanel, you are still grieving?
Yeah.
How are you doing?
It's difficult to say because it just, with losing my brother, it's left a huge hole in all of our lives, and complete devastation I don't think even comes close to describing just the complete heartbreak of losing him and what life is now like without him. He was our light, and you just don't know how you find a way forward. So I think it's putting as much focus into doing what we can around raising awareness, and really ensuring that his legacy lives on in that way.
And you, as far as I'm aware, you had no idea that your brother had started taking it again, had essentially relapsed, did you?
No, not at all. I think the first time we even knew that my brother had previously battled with any sort of ketamine addiction was when he appeared on Drag Race. So we learnt that at the same time as the rest of the nation, really, watching the show. And it was so heartbreaking to know that he'd been through what he had been through during that addiction period and not been able to seek help or speak to us. And we had no idea at the point that he passed away that it had become an issue again in his life.
According to Holly, who you met in Wrexham, people think it's a party drug. She told us you get a buzz out of it, it lasts for 30 to 40 minutes, that's when the effects wear off. Do you think people are actually aware of how addictive it is and how much damage it can do to your body?
No, not at all. It's extremely addictive, it's extremely dangerous. And obviously in Holly's case, she's a young lady that's been massively affected by taking ketamine, and that's indicative of what we're seeing amongst the younger generation now, where I think they don't necessarily know the level of harm that is lasting with ketamine and ketamine use. And obviously in my brother's case it was fatal, and if we can raise awareness around the dangers of taking ketamine, then I think that that's what needs to happen to try and deter the younger generation.
Councillor Hinnigan, you raised the issue of ketamine at Liverpool City Council. Why?
I felt, and it's been something in my day job when I'm not a councillor, I work for Local Solutions. It's a charity. We deliver services in North Wales, mainly across the city region. And we work with vulnerable young people. It was, for the last couple of years, it's been reared in his head. I was a former youth worker, so I have lots of contact with young people and parents. And it was becoming more and more and more. And then I was hearing of people within the community who were actually dying from it. And I thought, you know what, as an elected member, we have a responsibility. We have a responsibility to raise this. So I took the motion to council, which was supported right across by all parties. And we were calling for actually three things around education for parents. Thankfully, on the back of it, we've had £500,000 for more youth workers, which we're desperate for. Youth workers in our city were decimated, but around education for parents, for youth workers, and also in the health profession. I've been to that many appointments with young people.
Have you?
At urology. I've attended so many appointments where I've actually not physically dragged them, but encouraged them, please come and seek help. But they're in that much pain, and the wait in A&E is that long. And there was definitely, I'm really impressed with that nurse, because there was a definite lack of understanding about this. So young people, so you go and you beg them and say, please. I attended the first ever ketamine only session in Liverpool support group a couple of weeks ago. And I took some of my colleagues from work, and at the lifeboat it's called, it completely blew me away, because there was young people there saying, I don't want to die. And I know we have to do something. I would hope it would be rolled out right across the city, because this is not exclusive to Liverpool.
No, absolutely. But you have said you fear it's worse than heroin in the 1980s. Why do you say that?
I think when I've spoken to people, and particularly in terms of so many people, it's so cheap, it's so accessible. You know, I've spoke to colleagues who have told me that one of my councillor colleagues that spoke at council when I did, she said she spoke to her parents in her community who said it's more accessible than buying baby formula. That is scary for someone to actually get up and say that, that what's coming back. So I think, you know, it is worse than, and heroin, you've got methadone, but with ketamine there isn't the service there.
Baroness Longfield, we spoke to a consultant urological surgeon at University Hospital Aintree who told us we see well over 50 young people in our urology clinics. Ket is cheap and easy to get hold of, and it is perceived to be safer than hard drugs like cocaine and heroin. As a former children's commissioner, how worried are you by it?
Well, really concerned. I mean, I think what we've heard, I mean, heartbreaking, but also shocking.
Yeah.
And this is something which I think is largely hidden. And it's hidden to a lot of the teachers. A lot of this goes on in schools or in parks as well. It's hidden to parents. They will often not know anything about it. And in certain parts of the country, I don't know the extent of it, but it seems to have taken such a grip and just become part and parcel, one of these, you know, new pressures in children's lives of being a teenager. And the accessibility of it, the cheapness. And I've been told by teachers that, you know, those that are dealing in it do it by Snapchat. It comes to the school. Yeah. Tell your friends, come and get it, and you can share it out. That easy. Yeah. So people, you know, we need to be very alert to it and absolutely act now in terms of making this something which everyone can see. We need to bring this out into the open.
Chanel, you would like the government to reclassify it from a Class B to a Class A drug. You will remember I asked Holly if that would have stopped her taking it.
Yes.
She said no. Why do you believe it would make a difference then?
I think it's a first step. In the classification needs to be in line with the risks that are associated with ketamine use, because the risks are very severe. Yeah. But I think it can't be a singular approach. In 2021, the government brought out a strategy around drug use. We need to revisit that. It needs to be indicative of what is happening now, and it needs to focus on ensuring that there is enough support and recovery services available for people. So I think it can't just be a singular, I really want to push for the reclassification, because I do believe that young children especially, looking at that, think it's less harmful than another drug.
Right.
So that is important. Yeah. But we also need to look at education, policing and health, and have a multi-agency approach to really tackle drug use.
The policing minister has written to the Advisory Council on the Misuse of Drugs, expressing the government's concern about the growth in the use of Ket, asking them to look at whether to reclassify it. They say, we will not hesitate to act when the council reports back, and in the meantime we'll continue to work across health, policing and wider public services to drive down drug use and stop those who profit from its supply. Would you support reclassification?
Well, clearly, you know, she'll be asking for that advice, but in principle, yes. because actually what you've got here is a drug that is seen as being a party drug, seen as being harmless, seen as being something that actually kids take to chill out in the park, but actually with, you know, tragic consequences. But I do think, you know, it can't just be that, because young people, that I don't think that will deter them. But I'd also say, you know, this is a public health emergency. We need public health to be involved in this and to be running information campaigns. And also the police, we need to stop the police to stop those that are dealing in this to get to kids in schools and in parks. It needs to be that coordinated approach. But, you know, it does mean that we've got to act quick, because these kids today are taking dangerous levels.
And it's happening now. You know, we need to address it now, because it's a massive issue, and we're not prepared either to face what's coming, what's ahead of us for those that are already addicted to ketamine. There aren't enough services available. It needs more funding, it needs more investment, and more of a well-rounded approach.
I spoke to Matt Ashton, our Public Health Director. He's fantastic, Matt. And he was saying, you know, we have got an action plan now, which we're looking at all them things, bringing all the multi-agencies together. We're going to hopefully hold a summit in the city to actually look at it and bring everyone round the table, because since the motion went out, it's imploded.
Okay. And you've got your meeting with the Policing Minister in a couple of weeks.
I have, yes.
Thank you very much, Chanel Williams and Baroness Longfield.
Thank you so much.
Thank you. Thanks for being with us.
Thank you.
And by the way, if you need any help or support with addiction, do call the BBC Action Line. It's 0800 066 066. Lines are open 24 hours a day and calls are free of charge.